So a good place to start, I think, is to tell you a bit about Oxleas. We're not just a mental health trust, but we also provide community services. We employ 3,500 staff across maybe 20 or more disciplines. We really work out of 4 hospitals, 1 community hospital, 2 acute, and 1 more hospital, the Queen Mary's Hospital, which we own. That will provide probably 35 or 40% of services from that side, and the rest of the site is care is provided by lots of other partners, acute partners, NHS and non-NHS partners. I'm not aware of any hospital of this nature, certainly in England, where you have lots of partners coming together and providing care for local people. And we invest in something of the order of £30 million to see that this site becomes a real hub of healthcare. And that takes me on to this notion of patient experience. And we have had a program in Oxleas for many, many years. Because we see this as being absolutely vital, particularly when you think about the sort of work we do. We don't run high-tech services. We don't operate on people. We look after people with chronic conditions, what you and I may call as long-term conditions. So people with schizophrenia, people with bipolar, with diabetes, with chronic obstructive pulmonary disease. So we use a number of methods to capture information, but perhaps the commonest is asking them questions using a questionnaire. And there are 6 questions that we ask irrespective of where you are across the entire organization. The first 4 questions, those are the things that at every opportunity, at every contact, you need to make sure that you leave the patient with no doubt that they have enough information about their care and treatment, they're involved in decisions about their care and treatment, they've been treated with dignity and respect, and that their carer or family have been supported. And then we ask 2 further questions. Has that intervention made a difference to your life? And the last one is, would you recommend our services to your friends and family? And what is most important to my mind is that people need to see what we're doing about their responses. The other thing that we do, particularly in areas where we find that there are challenges, perhaps lots of complaints, incidents, etc., is that we ask a group we call our research net, consisting of users of services, to go in and talk to service users face-to-face and gather more information than we can get from questionnaires about what's working well and what's not working well. And then we work with the teams to try and bring about change, to make the differences and to co-produce in terms of how that can be realized. Talking about our staff, I think no one would doubt that staff are absolutely critical. And we do everything that we can do in our organization to make sure that they are in fact the best that they can be, supporting them in every way possible. So supervision is something that needs to take place, making sure people have had their annual reviews, for example, making sure that they have access to CPD. But I want to say a bit more about our partnership working with staff side, because I think that merits special mention. So we've got a partnership team who really can go anywhere in the organization and speak to anybody. So they have free access to your chief exec, free access to your director. One of the directors is sat there smiling because we really are all frightened of Wendy. You know, she comes in, she tells you what's working, what's not working, and she demands responses. So every year she runs about 60 focus groups. It doesn't surprise me, therefore, that when the King's Fund in 2014 published their engagement score, Oxleas was rated number 1 of several trusts. Of course, developing staff is important, and so we have a bespoke management development program for those who are aspiring to be managers, or indeed those who are already managers, that helps them to develop personal skills for managing, and also helps them to be more efficient in leading the services that they manage. And it's through action learning and mentorship in the workplace that we try and embed this further in practice. And then they all wanted to get their teeth into something. They wanted to change programs within their teams, to do things within the organization. And for that, we again turned to the King's Fund to say, well, can we run a strategic quality improvement project? And from doing that work, we found that there were a little over 300 projects, research, audit, service improvements that were being run in the organization. And the question really for the group, which consisted of the doctors, senior clinicians, and of course the management teams of our 5 directorates, was how do these projects align with the organizational goals? How do they align with the directorate goals? And through the work that went on over several months, we managed to whittle this down and to have directorates think about things that would really make a difference to get us to a position that we are struggling to get to. But of course, you can't do all of this without being in an organization or an environment that enables this work to flourish. In terms of governance, we have very good systems, But in addition to that, I think that the board, certainly in the 7 years I've been there, has really been very keen to make clear that quality is the absolute priority.